Hello, I'm Catherine Huddle with the Carmel Clay Public Library, and I would like to welcome you to a special presentation on hip and knee pain with Dr. Leonard T. Buller, an orthopedic surgeon with IU Health. If you should have any questions or comments during today's presentation by Dr. Buller, please feel free to put them in the chat box and we'll answer them during the Q&A portion at the end of today's program. I'm so pleased to introduce Dr. Leonard T. Buller. Dr. Buller specializes in adult reconstruction of the hip and knee. His approach to caring for patients with disorders of the hip and knee involved personalized treatments, including operative and non-operative, as supported by the latest evidence. Dr. Buller earned his medical degree with special qualifications in biomedical research from the Cleveland Clinic Lerner College of Medicine of Case Western Reserve University. He completed his residency at the University of Miami, Florida. There he was appointed chief resident, elected an emerging leader for the American Orthopedic Association, and received the Health Volunteers Overseas Resident Traveling Fellowship to volunteer in the Kingdom of Bhutan. That's amazing. His fellowship in adult reconstruction and joint replacement was completed at the Hospital for Special Surgery in New York City. He's a member of the American Association of Hip and Knee Surgeons and has authored numerous publications, earned multiple research awards and grants, and presented his research nationally and internationally. Dr. Buller considers research, education, and leadership central to the delivery of the highest quality, patient-centered orthopedic care. Dr. Buller, we're so pleased to have you join us today.
Thank you so much for having me. I'm thrilled to be here. I think this is such a wonderful opportunity. And thank you for that kind introduction. So I'm a joint replacement specialist, a hip and knee replacement specialist at the Indiana University School of Medicine. And today I plan to chat for the next bit of time on a topic that I'm extremely passionate about, and that's hip and knee arthritis. So we're going to begin with a little background before getting into the meat of the presentation. I plan to discuss arthritis, what it is, what it feels like, what can be done about it in terms of treatment. And then I'm going to get into the state of the art about hip and knee replacement and what the new techniques and technologies are that exist to improve your outcomes and speed up your recovery. And finally, I'm going to wrap up with a talk about some of the most commonly asked questions I get in the office. So though I may look young, I did start my journey on a career towards hip and knee replacement nearly 2 decades ago. After college, I attended medical school at the Cleveland Clinic, and my wife, who actually is a native Hoosier, and we used to study for exams at the Carmel Clay Public Library 20 years ago, we got married and moved to Miami, Florida for a 5-year residency. And while she was a resident in anesthesiology, and then I had a really pretty unique opportunity, like you mentioned, to travel to the Kingdom of Bhutan. It's a Buddhist kingdom in the foothills of the Himalayan mountains, and it was really a special time of my life, getting to see a completely different perspective, both in healthcare, but also in the way the world works. And then I headed to New York City with my wife, and while in New York, I completed a fellowship in hip and knee replacement surgery, specializing specifically in those two things. And that provided me with advanced training in the most cutting edge techniques at the #1 hospital in the entire country for this field. And knowing we always wanted to return to the Midwest, IU Saxony and the IU health system was the perfect fit for me. So as you may know, Saxony opened in 2011, and it was a specialty-focused hospital that provides patient-centered care to optimize outcomes following joint replacement surgery. We're the only hospital in the state to offer a fellowship in joint replacement, which basically is where surgeons come that have finished all of their training and could be out on their own, but they actually spend time with us to learn the best practice techniques, and they can bring them back to their own hospitals around the country. We also develop and publish nationally and internationally renowned research on hip and knee replacement topics, and this allows us to continually provide better and better outcomes. Since its construction, Saxony's become the largest volume hip and knee replacement hospital in the entire IU health system, and we're a referral center for most of the revision hip and knee replacements that take place in the entire state. That's after a first time hip and knee replacement, when something isn't exactly perfect, we get the referrals to help figure out what's going on and make patients' health better. Because of our excellent outcomes, we were named an IU Health Hip and Knee Center of Excellence, and we're actually one of the only 2 such named centers in the whole healthcare system, the other being a Simon Cancer Center. And we recently received the highest distinction by the US government in terms of our care. So pretty exciting. So with that background, I'd like to dive into the topic of osteoarthritis. Osteoarthritis is the leading cause of disability among adults in the United States. It affects over 70 million people in the United States. And if you personally aren't affected by it, I'm pretty confident somebody close to you likely is. And hopefully this information will be useful for you. So what is osteoarthritis? Simply put, osteoarthritis occurs when the cartilage or the smooth gliding surface on the end of the bone becomes destroyed and the bone edges rub on each other, or bone to bone. What we can see from these two images, the one on the left has excellent cartilage, that pearly white stuff, and the one on the right, the cartilage is completely gone. And in that patient, they have bone on bone, and that bone rubbing on bone results in pain. So how does typical arthritis present? Well, most patients describe a severe groin or buttock pain or a thigh pain that's worse with walking, but can actually occur at rest. Patients with hip arthritis develop a progressive limp, and they note decreased hip range of motion, leading to difficulty putting on shoes and socks, getting in and out of a car, or going up and down stairs. And you can see here in this image, those red lines, that's an example of a hip joint. So the hip joint's a ball and a socket joint. And what you see is the bone is white. And so you've got the ball, which is white, and the socket, which is white. And in between that, there should be a nice space. That's where cartilage sits. This is an example of arthritis, where you can see that that bone is completely rubbing on bone, and that's very painful. So on the knee side, osteoarthritis of the knee presents similarly. As the cartilage wears away, patients develop pain and stiffness with decreased motion, and over time, their ability to walk longer distances goes down. Patients sometimes resort to using a walking aid like a cane or a walker because of the pain. And also in the knee, the sensation of giving out is oftentimes felt. So what causes osteoarthritis? That's a great question. And this has actually been an area of research for a number of years. And what we found is that the cause of arthritis is actually multifactorial, meaning that multiple things contribute to the development of arthritis. One of the biggest contributors is actually genetics, as people who have parents with arthritis are actually at a higher risk of developing arthritis themselves. Additionally, things like increased stress on a joint increase the risk of arthritis, as we found high impact activities like sports and trauma and even obesity are all linked to developing arthritis. So after we've made a diagnosis of osteoarthritis, I recommend a number of different non-operative treatment options for pain and discomfort from the arthritis. Generally, this is going to include a course of physical therapy, some stretching and exercising, anti-inflammatories, and potentially even injections. Unfortunately, once the arthritis is very severe, there are no pills or injections that are going to be capable of regenerating that cartilage. Even things like stem cells or PRP, which is platelet-rich plasma, just hasn't been shown yet to quite get us there. And if all of those treatment options fail to alleviate your pain and you're significantly limited from that pain, we may consider joint replacement surgery. So today I'm going to talk about hip and knee replacements specifically. Hip and knee replacements are some of the most frequently performed surgeries in the entire country. And the goal of that surgery is to alleviate a patient's pain and improve their function. And these surgeries reliably accomplish those goals. The overwhelming majority of patients that have hip and knee replacements report an improvement in their health, and this allows them to get back to the things they want to do without pain. But what exactly is a hip replacement? Well, in a hip replacement, I remove the diseased or worn out ball, and then I resurface the socket with just taking a few millimeters of the arthritis away and replace it with a new smooth gliding surface. The implants that I use are made of a durable metal alloy that is hypoallergenic, and the body actually incorporates into itself and becomes its own during the healing process. The new smooth gliding surface is oftentimes made of a smooth ceramic ball and a polyethylene plastic liner. On the left side, we can see an example of an x-ray of what a hip replacement would look like. And on the right, we're going to see an example of what an actual hip replacement looks like. So it's kind of cool to see. A total hip replacement normally takes about an hour and a half to perform, and my patients are up walking with all of their weight on the leg the exact same day of the surgery. I expect that over 95% of the modern hip replacements that I'm putting in today to still be in place 20 years from now. That's oftentimes a pretty common question that people have is, how long is this going to last? In terms of recovery after a hip replacement, I generally don't prescribe physical therapy and really just send you home with some exercises. A therapist might come to the house to check on you. But walking and these small exercises is really all you need to achieve an excellent outcome. With today's technology, a knee replacement is probably more aptly termed a knee resurfacing operation, because in surgery, basically what I do is I remove the diseased portions of the knee and then replace it with a new smooth gliding surface, kind of like the cap on a tooth in tooth surgeries. So it's not like the old days where we're cutting big parts of your bone out. This is a minimally invasive technique. And when you combine that with cutting edge pain control options, I'm able to get my patients up with therapy the very same day of surgery. On the knee side, knee replacements do tend to get stiff though. And so if we're not using them within the first few days, I encourage a physical therapist to come to the house. We do some physical therapy exercises. And similarly, in terms of the lifespan of a modern knee replacement, I expect over 95% of my knee replacements to be around for at least 20 years or more, hopefully. Especially now that I'm using computer technology to put these in the perfect alignment that matches a patient's anatomy, that should hopefully not only improve the feel of the implant, but also the longevity or the lifespan of that implant. So what's new in joint replacement? At this point, I want to share with you some of the novel innovations that have propelled our field further and improved patient outcomes. The first one is new biological materials, and specifically porous metals. So porous means that the structure is similar to your bone, and as a result, your body actually grows into it and onto it, and it becomes your own body. These metals are non-allergenic, and as a result, if it becomes part of your body, it can result in excellent long-term fixation. So here's some micrographs or small images of the porous metal, and what you can see there, that black is the metal on the top, and the bone is purple. It's been stained purple. And what you can see is the bone actually interdigitates and grows really intimately with this metal. And particularly in revision surgeries, this has absolutely revolutionized outcomes. So what about minimally invasive techniques? Well, in the knee, I perform a surgery where really I'm only removing the diseased parts, preserving the bone and the ligaments you were born with, which is going to improve the feel of the knee and hopefully speed up your recovery. A total knee replacement generally replaces the thigh bone part or the femur, the end of that, the shin bone part of the tibia, and sometimes the kneecap or the patella in select cases. In contrast, a partial knee replacement only replaces one of these three. So on the left side, we can see a partial knee replacement in a bright white. And then on the right, you can see a total knee replacement where both sides of the knee are replaced. A partial knee replacement isn't right for everybody. And in the office, I'd discuss with you which is probably the right choice. But it could be appropriate as it will help you keep more of your own bone, cartilage, and ligaments. So again, a partial knee replacement, it's a little easier to recover from in comparison to a total knee replacement. And that might get you back doing things quicker than a total knee. But it's only in appropriately selected patients. If you have disease on the outside of the knee or in the kneecap, it's not the right choice. And so that's not everybody. But a partial knee replacement does have pretty good track record in terms of the durable results. And evidence would suggest that 96% of partial knee replacements in appropriately indicated patients are in place 14 years after surgery. So before surgery, I get x-rays of your knee and the joint or the hip, and I actually template your bony geometry to give you an implant that recreates your anatomy. Again, that's going to improve the feel of the joint. And on top of that, I use a computer navigation system that puts the implants exactly where they belong in space. And that hopefully improves your functional outcome. Additionally, it reduces bleeding, about 1 liter of bleeding, to be honest, and provides very reliable and reproducible outcomes. So in addition to these techniques, I use modern implants. And these implants were actually designed in a way that recreate your native anatomy. Again, just giving the knee a more normal feel. So how about on the hip side? Well, there's multiple approaches to the hip to perform hip replacement. Part of the reason they recruited me to come to Indiana University was I perform a surgery called the direct anterior approach, or the muscle sparing approach to the total hip. And it really truly is a muscle sparing approach. I don't have to cut any muscles on the way in, and it's pretty minimally invasive. And it's been shown to result in a faster recovery, but again, with the same durable results that a typical hip replacement does. So finally, advances in our surgical technique, the rehab protocols that we have, and also our pain control, we've been able to offer outpatient joint replacement to appropriately selected patients. All of my patients see a specialized internal medicine doctor before surgery, and we determine if you're eligible for an outpatient joint replacement. And especially in the setting of the recent pandemic, the COVID-19 pandemic, it's been very beneficial to keep you out of the hospital, get you home safely and on the road to recovery as quickly and safely as possible. So all of these modern techniques that improve outcomes are things that we've actually studied, and this is with the scientific process. So we know that the things we're doing are not only safe, but also beneficial. And not surprisingly, we have hospitals from around the country that are adopting our techniques and our practices into their own patients. So we get frequent calls to come visit or just have discussions about what the best case practices are. So at this point, I'm going to get into a couple of frequently asked questions if we have time. Otherwise, I might actually pause here and I'll take any questions that we have first. How about that?
Dr. Buller, we have a question here in chat, and we have someone who would like to know if a person with osteoporosis can have a successful knee or hip replacement.
It's a wonderful question. So the question is, can somebody with osteoporosis undergo hip or knee replacement? And the answer is yes. First of all, what is osteoporosis? So osteoporosis, the definition of osteoporosis is weak bone. So the bone biology is okay, but the actual quantity of bone that a person has is less. As a result, it makes that bone weaker. And osteoporosis is a diagnosis that can be made by your primary care doctor or an orthopedic surgeon or a rheumatologist. Typically, there's some scans that are involved. And once osteoporosis sets in, people are at a higher risk for things like fractures, either wrist fractures or hip fractures or spine fractures. So it's really important to talk with your primary care doctor to make sure that your bone health is being assessed and that you're taking the appropriate precautions to prevent osteoporosis. But once you have osteoporosis, if you have osteoarthritis, which again is the wear and tear of those joints, we take that into consideration and we can modify some of the surgical techniques to reduce your chance of complications in the setting of osteoporosis. So hopefully that answers the question, but yes, we can do joint replacement in somebody with osteoporosis, but it's really important to know that beforehand to try and reduce your complication rate and improve your outcomes. Other questions?
Feel free to put those questions in the chat at any time for Dr. Buller.
So some of the other questions that we frequently get are, when is the right time to have surgery? Or how do I know it's the right time? Or can I wait too long? Well, to the last point, can you wait too long? Not really. Unlike some medical conditions, osteoarthritis, it can't kill you, but it can hurt pretty bad. And so waiting too long, probably the only problem with waiting too long is that your muscles become quite debilitated and the recovery just is that much longer, or you're just not as stable. Plus you're suffering from pain for a long time. But as surgeons, we're always here to help. And the right time to have surgery really is when the symptoms from your arthritis become so severe that you're significantly limited in the things that you want to be able to do. And if that's because of your arthritis and we can fix that with surgery, then I think that that's most of the time when patients decide to have surgery. Other questions?
We have another question here. How long will I expect to be out of work for a knee replacement?
It's a great question. So that's an extremely common question because we got to get you back to doing the things you want to do quickly. So let me just walk through the typical recovery. Surgery itself, again, takes about an hour and a half, 2 hours. You're in the hospital that day. You'll be working with a physical therapist the same day as surgery, putting all your weight on the leg. And then you either spend the night in the hospital or you go home the same day. And then that next day you'll go home. On average, there's about 2 weeks of, I know I had surgery, this is a little bit sore pain, but we manage that with a multimodal regimen of pain medicine. So a couple of different types of pain medicine to reduce your overall need for any particular one. And that cuts down on side effects. But most people are back to desk jobs, not pretty heavy labor jobs at around 4 weeks, maybe 6 weeks. And then more standing jobs if you're in a factory or doing a lot of heavy lifting, between the 6 week to 7 week range on average. The overall recovery after a hip or a knee replacement, though, in my mind, is you're back to work is actually sometimes up to a year. So the muscles and the tendons and the ligaments that get weakened as a result of the arthritis, they need a lot of time to regrow and to regenerate. And so most patients feel gradual improvements in their function for up to a year after the surgery. So it's not uncommon that I see a patient at 6 months or 8 months and they're still feeling like they're improving and doing more and biking further or running or walking further distances. So just that's also something to consider. Other questions? This next set is about activities. I kind of just alluded to them earlier, but really there aren't any activities you can't do after a hip or a knee replacement. Everything is with caution, obviously, until you start getting good at it again. But I have patients that do pretty much any physical activity that they want after surgery. Kneeling is also a common question. So I have a lot of patients for religious purposes or for work purposes that need to kneel. And while it's not fun to kneel on a normal knee, after a knee replacement, we can do certain things to modify the way that we're doing the surgery. Able to after. And so those are the big questions. Other questions for me?
Here's another question, Dr. Buller. Do I need x-rays before I see you?
So the next question is about x-rays beforehand. Well, it probably would be helpful. It's certainly not necessary. We have x-rays in our office. We do some special protocols for x-rays. So if you want to avoid extra radiation, it's always an opportunity to just get the x-rays while we're here, the correct protocol x-rays. But certainly having x-rays beforehand to know the diagnosis is helpful as well. So no, you don't have to beforehand. We can get them here. Other questions?
Oh, here's a great question. You mentioned computers. Does a robot do the surgery?
Oh, that's a great question. So there's a difference between robotic and computer navigated surgery. I'd encourage you, if you wanted to check out, I do a podcast once a month for the American Association of Hip and Knee Surgeons. I'm a part of the organization Young Leader. And one of our topics was actually this exact topic. So it's about maybe a 40-minute podcast if you're interested. Feel free, we can get you the information for that, or you can just Google Leonard Buller, American Association of Hip and Knee Surgeons podcasts, and it should pop up. But basically the question is, how do we put in these implants? And there's 3 different ways. The first is the conventional way, where you use generic jigs to basically do the surgery the same way for every patient, regardless of their anatomy. And that's the way they were traditionally done. And as technology developed, what we have come up with are 2 more patient-specific options. One is a computer navigation system that basically navigates or maps out the entire knee or the hip and helps us determine what your normal anatomy should be, and then recreates that with the computer software. And then the other option is a robot that actually requires somebody to come in with a wrap, a device wrap, where the robot actually wheels itself in, and it requires some pins in your femur or your thigh bone, pins in your ilium or your iliac crest, your waist bone, or in your shin bone, which can cause pain and fractures. And then basically does the same thing that a computer navigation system does, where it maps things out and then does the cutting for you. The outcomes are exactly the same. There's no difference. It's just there's extra steps with the robot. There's potential risk with fractures from the pin sites or infections from the pin sites. So until there's better evidence, one versus the other, if you can get the same information with less risk, I think that that's better for our patients. Hopefully that answers that question, but there's multiple ways to do it.
All right, Dr. Buller, we have another question here in chat, and this is a great question related to COVID. Is it safe to have something like this done during COVID?
Yeah, that's a wonderful question. That's actually my next little slide is about, and I didn't know if we were going to get into it or not, but yeah. So we at IU Saxony at the Hip and Knee Center were on the forefront of addressing concerns about COVID. And so we've kept those practices up. Everybody is either vaccinated, patients are either vaccinated or get tested beforehand. We have strict isolation precautions, and each room is a private room. Everybody is extremely isolated, and so we have it down to a science. And the number of cases in the whole state were the lowest at IU Saxony. So it's pretty remarkable. So much so that that other hospital systems were calling from around the country to ask us how we were doing, what we were doing. But so the short answer is yes, it's safe to have a hip or a knee replacement in the setting of the pandemic, the COVID-19 pandemic. And the nice thing about it is we've actually learned a lot more about how to do rapid recovery safely, to get people out of the hospital quickly and safely. And so we haven't really seen, and disease transmission rates in hospitals are extremely low to begin with, but at Saxony it's exceedingly low. So I'm glad we talked about that. Really good question. Other questions?
Dr. Buller, we have some comments here in chat thanking you for your presentation.
Oh, good. It's really a delight to be here. I'm very grateful to have the opportunity to talk about something that's honestly my entire life. I love it so much. So being able to take somebody that's debilitated from hip or knee arthritis, that can't walk, isn't doing the things they want to do, they can't accomplish those goals, and to be able to do something well and give them an opportunity to get back to the things they want to do. It's the best job in the world. So I'm happy to be here and talking about it.
All right, if you have any final questions for Dr. Buller, make sure you go ahead and get those in the chat before we conclude today. The library would like to thank Dr. Buller so much for this very informative presentation on hip and knee pain and your options. If you would like more information on Dr. Buller's services, you can reach out to him via the web at myiuhealth.org or by calling 317-944-9400. You also want to check out his podcast with the American Association of Hip and Knee Surgeons called AAHKS Amplified on Apple Podcasts or wherever you get your podcasts. You also want to keep an eye on all of the upcoming programs that the library has to offer virtually and in person by visiting us at carmelclaylibrary.org.